Compare the benefits of CO2 Fraxel and the Erbium Fraxel laser and expectations for phases of treatment. What are the benefits in terms of treating pores and under-eye wrinkling and generating collagen with the CO2 Fraxel laser and the Erbium Fraxel laser? Please explain how many treatments are needed for results for deep pores and the laser depth and number of passes per treatment.
Thank you for your question. You submitted your question without a photo, and you're asking about comparing the benefits of fractionated CO2 laser versus fractionated erbium laser in terms of the levels and depths, numbers of treatment needed, and basically the problems that you're concerned about have to do with pores, with under-eye wrinkling, and of course collagen induction. Well, I can completely understand why you're asking this question. We live at a time where there is a lot of literal commoditization of these devices, and essentially they all start to look the same and make the same claims. I'll share with you my approach in my practice to help guide you, I think, to what would be a strategic or a strategy that will be helpful for you in your quest to find the right answer for you. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have been using lasers since the very beginning of the use of lasers, especially in facial skin resurfacing, beginning with the original CO2 lasers in the mid-90s. And I have in my practice essentially every laser you can think of. In fact, because we have two offices, we have essentially two of every laser that are applicable for the type of practice I have. So I think that why it is becoming confusing is that there are certain principles that are guiding principles on how we treat our patients that have to do with the effects on the skin, and that the lasers are essentially tools. Unfortunately, these things are, because the strategic approach to skin treatment is difficult to convey, it's often supplanted by or overshadowed by a new flashy name of a laser. And that laser gets airtime on different talk shows, and then everybody runs in that direction. And then 6 months later, another laser shows up, and everyone runs in that direction. There are some basic principles to understand. Whether it's erbium or CO2 laser, you're dealing with essentially different levels of ablation, which means removal of skin, and different levels of thermal energy delivery, which means delivering heat in the skin to induce a healing response that results in more collagen and tightening of the skin. Now, because of the advancement in the ability to tune the lasers to do what you want, in other words, varying degrees of depth as well as varying degrees of heat delivery, depending on the device you have, you can actually have comparable results between the two lasers. The laser manufacturers have become extremely sophisticated with computerization and technology so that you can get comparable results whether you used an erbium fractional or a CO2 fractional. But when you get down to what you need, you have to think of what is a strategy. There's a basic, straightforward rule. The deeper you go, the more thermal energy you deliver, the longer it takes to heal. A lot of times people are frustrated because they want to essentially get out of a laser treatment the same thing that they want to get out of a surgical treatment. So for example, if I take care of someone's under-eye bags, well, this is a procedure where once I take the bags out and I have improved the appearance, that can be stable for many years and they will not need another surgery. Skin is different. Skin can benefit from an aggressive treatment, but almost always you have to think of a maintenance strategy. And one of the things that I observe constantly are people bouncing from one medi-spa to a medi-spa to a dermatologist to a plastic surgeon to whoever, jumping from one treatment to another. My philosophy is straightforward. You have to have a treatment plan. You should have a strategy as to what to expect out of the treatments that are offered, and understand that whether you're dealing with aging, sun exposure, or combination of both, as well as other environmental issues, whether it's smoking and other things that have to do, or genetics, you are dealing with something with skin that has to be continuously monitored. Now, when you talk about pores, for example, we use something called a Q-switch laser, where there's no downtime. We use this laser to treat pores, and we're able to get very nice results, and the patients don't have to worry about being raw and having to wait for a healing process. Now, understand that pores do require continuous treatment. You don't just treat pores once and never treat them again. It's just a matter of treating, observing, treating, and observing. When it comes to other issues, whether it's wrinkling, wrinkling can also be treated not just with laser devices. We use something called platelet-rich plasma. With platelet-rich plasma, we're actually injecting below the skin and within the skin, and we're stimulating collagen. This platelet-rich plasma strategy is getting a lot more love these days because now the dermatologists and plastic surgery journals are actually publishing data supporting what we've been saying for many years, and we're not being taken seriously, but just through clinical experience, that you're inducing collagen, you're inducing new blood supply, you're improving the fatty cell layer under the skin, and so you can actually balance how aggressive you are with the laser by using PRP in conjunction. Other strategies also include such as microneedling. Microneedling can also stimulate collagen. So I think that you want to step away from comparing devices. It's very easy for anyone to buy a device. Any physician can buy a device, and depending on the state, you don't even have to be a physician to buy a device. And what it takes is knowledge, experience, and judgment, and as far as I'm concerned, the willingness to follow the patient not just for a series of treatments, but for years to really manage. So what I would recommend is you find a doctor who is going to be with you for the long term, and don't expect that one particular treatment will have you covered for years. You may get a significant improvement with one treatment, but you will likely need some kind of a maintenance plan. So it does request investing time, resources, effort, etc. in order to do that. But I think it's important to be more realistic by having an understanding that it's the doctor who is doing the procedures and looking and is trying to help you, and having that connection more than any specific device. So I hope that was helpful. I wish you the best of luck. Thank you for your question.